Hi folks, Dr. Ed Beyer. Today we're talking about one of the 22 ways that thyroid expression can be low. There's 22 known causes of hypothyroidism in the scientific literature. Traditional medicine looks at one of them. Today we're doing number 17, elevation of what's known as thyroid binding globulin. Thyroid binding globulin is a protein in our blood that carries the hormone around into our body, taking it to where it needs to go. It's like a taxi cab. And when the thyroid binding globulin is elevated, and there are certain things that'll do that, which I'm going to get into, when thyroid binding globulin is elevated, there's too many taxi cabs and not enough free fraction of the T3 hormone. Hormones exist in two states. They're either attached to a protein, or they're in the taxi cab, or they're not attached to a protein. That's called the free fraction. That's the active usable form. It's really important. So if you have too much of these binding globulins, then T3 can't get out and do what it does in our cells, which is actually goes into our cells and turns genes on and off, controlling our metabolism. On the blood work, what we're going to see is a very important marker that we run on all of our patients called T3 uptake. When T3 uptake is low, we know that there are too many thyroid binding globulins and not enough free T3. And so the expression is low thyroid. And I tell all my patients, this is never looked for. And this is a common cause, actually. I see this quite a bit. One of the causes of elevated TBG and low T3 uptake and too little free T3 is estrogen dominance, which is a condition I see in many of our females that come into the clinic. And the number one cause of estrogen dominance in younger females is birth control pills. Birth control pills elevate estrogen levels, tricking the brain into thinking that the woman is pregnant, and so they don't ovulate and they can't get pregnant. And when a female doesn't ovulate, their progesterone levels drop, estrogen levels go up, and they have an estrogen dominant situation. And then a lot of my females come in to see me. They're on hormone replacement therapy. A particular one, which is really a nasty one, synthetic, is Premarin. And that is actually estrogens that they get from a pregnant horse's urine, hence the name mare in there, okay? That's I see a lot. Another reason for estrogen dominance, which will cause this condition, are xenoestrogens or phytoestrogens. Xenoestrogens are compounds that are found in our environment that get converted into estrogen-like chemicals in our body. And phytoestrogens are chemicals in different foods that we consume that have an estrogen-like effect in the body. Pesticides and herbicides, especially atrazine, which is used on all corn products. Again, though, if you eat organically, you don't have to worry about this. Plastics like bisphenol A or PBA for the acronym, creams and cosmetics that contain parabens, nail polish and nail polish removers, new carpet, fluoride in our toothpaste, fabric softener, and microwaving foods in plastics will also cause estrogen-like xenoestrogens in our body. Soy has these compounds in it that will convert into estrogens in the body. Sometimes can be helpful, but sometimes can be detrimental to our bodies. So these are some of the compounds found in our foods and environment that will cause estrogen dominance, that will cause this elevated TBGs and not enough free fraction of the hormone. Estrogen dominance due to low progesterone. Sometimes estrogen dominance in females is not due to too much estrogen, but not enough progesterone to balance the effects of estrogen. The ratio of progesterone to estrogen in the second half of a cycling female in the luteal phase should be 25-1, and I rarely see that. And then a common cause of this, again, is birth control. So why is estrogen dominance so prevalent in our society? I see it like daily in my clinic. Xenoestrogens are everywhere. They're everywhere. Poor liver or detox. If our liver and gallbladder is not working, or if someone doesn't have a gallbladder, estrogen is one of the longest, it has the longest half-life, it lives the longest in our body. It's very difficult to get rid of. Obesity, estrogen tends to be stored in fat. Less pregnancies. Females aren't having as many pregnancies as they used to 30, 40 years ago. When a female is pregnant, they emit gobs of progesterone, which decreases the ravaging effects of too much estrogen. And then contraceptive use. Constipation is a common cause of too much estrogen or estrogen dominance because the estrogens get reabsorbed right back into the bloodstream, and this will cause estrogen dominance. Poor or no gallbladder, we discussed. The other reason is progesterone in a female starts to drop in the early 30s, so that by the time they're 50 or 51 when they go into menopause, they can have up to 75% less progesterone than they did in their early 30s. And then they depend on their adrenal glands to kick in for the others. But if their adrenal glands are depleted, they're going to have low progesterone continues to drop. And remember, it's the ratio between progesterone and estrogen that's really important when it comes to estrogen effects on the body. So low progesterone is often the cause of estrogen dominance, not high progesterone. Estrogen dominance, here's how I want to say it. Estrogen dominance isn't always due to too much estrogen. It can also be due to not enough progesterone to balance the estrogen. So estrogen levels can be fine, but if you don't have enough progesterone, the ratio is skewed, and that's not a good situation. Proper testing is the key. Symptoms of estrogen dominance: fibrocystic breast, uterine fibroids. Look, estrogen is the hormone that produces the secondary sex hormones in a female. It causes growth. So if there are any abnormal cells in the breast tissue, ovaries, and uterus, estrogen dominance will cause those cells to progress. That's why most breast, uterine, ovarian cancers are estrogen fed. Hot flashes, vaginal dryness, hair loss, bone loss, weight gain, endometriosis. Ladies, a lot of females have endometriosis, but they don't have any symptoms. They have ectopic endothelium. Endometriosis is a situation where the lining of the uterus is not in the uterus, it's other areas, like on the fallopian tube, the ovaries, sometimes even in the abdominal cavity. And that tissue is responding to the estrogen surges that happen in a cycling female. But if there's too much estrogen or estrogen dominance, then those ectopically placed endothelial tissue will respond, and that causes the symptom of endometriosis. So a lot of times people with endometriosis, you can get the symptoms under control by getting whatever's causing the estrogen dominance under control. Miscarriages, because female needs a lot of progesterone to maintain a pregnancy. Other symptoms are anxiety, depression, mood swings because of the effects of the imbalance of progesterone and estrogen on the brain. And it contributes to estrogen-based cancers. Poor T4, T3 conversion. I talk about that in other videos. Very good book that I recommend to all menopausal females or females entering menopause is Dr. John Lee's What Your Doctor May Not Tell You About Menopause. So estrogen dominance is a very, very common cause of low thyroid expression. I'm Dr. Ed Beyer. Hope that helps. Have a great day.